Now to this breaking overnight news. Nearly 3% of Americans considered to be immunocompromised will be able to get another chance to boost their immunity against COVID.
So late last night, the FDA announced it has amended the use of both the PFIZER and the MODERNA vaccines to allow for a third dose for people who have a weakened immune system, such as someone who may need or already has received an organ transplant. Alexandra Leslie has been looking through the new documents. She's live in our breaking news center with the update.
Well, the FDA issued 2 letters published overnight, one to Pfizer and one to Moderna. The agency said it concluded that revising the emergency use authorizations to allow for a third dose in both vaccines was appropriate to protect public health and safety. Now, the reason being is that some immunocompromised Americans have not had high immune responses to the vaccines even after becoming fully vaccinated. The CDC recently cited a U.S. study which found 44% of hospitalized vaccine breakthrough cases involved immunocompromised people. An Israeli study reported similar figures. This FDA announcement says immunocompromised people 12 and up who got the Pfizer vaccine and those 18 and up who got the Moderna vaccine can get a third dose of the vaccine they got at least 28 days after their 2-dose regimen. The FDA made no mention, though, of Johnson & Johnson's single-dose shot. Dr. Fauci said yesterday health officials do not believe elderly or non-elderly who are not immunocompromised need a booster shot right now.
This is a dynamic process and the data will be evaluated. The one thing we are doing is we are preparing for the eventuality of doing that. So if the data shows us that in fact we do need to do that, we'll be very ready to do it and do it expeditiously.
Now, there are still a few more steps before those who may qualify for a booster can get a shot in Rhode Island. I'll explain those steps coming up in our next half hour. Live in the Breaking News Center, Alexandra Leslie, 12 News.
Breaking news overnight from the Food and Drug Administration. Agency authorizing this third dose of Pfizer's or Moderna's vaccine, for the nearly 3% of people that are immunocompromised in this country.
So 12 News reporter Alexandra Leslie is in our Breaking News Center to explain how Rhode Island is preparing for this new round of shots.
Well, you may recall back in March, the Rhode Island Department of Health put out several lists of high-risk conditions that would qualify to get the vaccine early, as well as conditions that result in a weakened immune system. Now, at the time, the state's list of conditions included cancer patients and those getting chemo, plus those who had or were waiting for a transplant, those with HIV or sickle cell disease, and people with a disease or taking medication that weakens the immune system. Pregnant people were also included on this March list. Now, the FDA's announcement, however, does not specifically mention pregnancy as a condition. The move comes as the highly contagious Delta variant continues to cause a spike in COVID cases across the country. Some immunocompromised Americans have not had high immune responses to the vaccines, leaving them vulnerable to the virus even after becoming fully vaccinated. 12 News asked the head of Rhode Island's COVID-19 response team on Tuesday if the state was prepared to launch a booster campaign.
We have several plans already prepared based on whatever guidance we might get from the FDA. We've been watching what they have been doing internationally. I'd say we're prepared to administer a booster if it's decided that it's needed to every single Rhode Islander.
Even with the FDA's green light, it is still up to a CDC advisory committee to make its own recommendation on who should get the shot and what factors they may want to consider. That committee is scheduled to meet later this morning, and it is scheduled to take a vote on additional Pfizer and Moderna shots. Now, this will also be triggering a meeting of Rhode Island's COVID-19 vaccine subcommittee. That committee is now only convening amid new vaccine milestones, such as booster shots. Live in the Breaking News Center, Alexandra Leslie, 12 News.